Hello, my name is Roxanne DuPaul, and I have a presentation on workplace violence in the healthcare setting and how nursing staff can learn to manage and de-escalate these behaviors. Practicum setting was Select Specialty Hospital where I am currently employed. Long-term acute care hospitals, or otherwise known as LTACs, are healthcare facilities for patients that need an extended period of time to recover following their initial hospitalization. We get patients from ICU, CCU, who need longer periods than what can be provided elsewhere, longer periods for rehab, respiratory vent weaning, and antibiotic therapy. Patients here require a high degree of advanced medical care provided by doctors, nurses, and other clinicians, care that cannot be provided by simply being transferred to a skilled nursing home or skilled facility. My goal in this project was to assess the nursing staff's knowledge of what constitutes workplace violence when giving patient care, to create educational materials for staff regarding workplace violence, and to clearly define what workplace violence is and put systems into place that enable the staff to recognize and react appropriately to ensure their safety and the safety of the patients. My objectives for this project were to identify what workplace violence is and the statistics of prevalence, to identify 4 patient behavioral changes that can assist nursing staff in identifying high-risk situations, and to discuss with the nursing staff what interventions are necessary to de-escalate a violent situation. The definition of workplace violence. The CDC National Institute for Occupational Safety and Health defines workplace violence as violent acts, including physical assaults and threats of assaults, directed towards persons at work or on duty. The U.S. Department of Labor defines workplace violence as an action, verbal, written, or physical aggression, which is intended to control or cause or is capable of causing death or serious bodily injury to oneself or others. Workplace violence includes abusive behavior towards authority, intimidating or harassing behavior, and threats. Occupational violence has been defined as the infliction or threat or harm or injury, either physical or psychological, upon another person in the course of their professional responsibilities. It includes verbal abuse, threats or intimidating behavior, and intentional physical attacks. Statistically speaking, according to the Occupational Safety and Health Administration, approximately 75% of nearly 25,000 workplace assaults reported annually occurred in healthcare and social service settings. Workers in healthcare settings are 4 times more likely to be victimized than workers in private industry. The Joint Commission states healthcare workers have a 20% higher chance of being the victim of workplace violence than any others. Also, the Joint Commission states only 30% of nurses report incidents of workplace violence due to the thinking that violence is part of the job. According to the Bureau of Labor Statistics, healthcare workers are 5 times more likely to be victims of non-fatal assaults than any other profession or industry combined.